Hello, my name is Austin Slate. This is my tracheostomy care video. Here's my ID badge. So, to begin, the first thing I would do is I would come in, introduce myself to the patient. I would then identify the patient using two identifiers, explain why I'm here and what I'm doing and how long it'll take. I would perform hand hygiene. I would make sure I have all my supplies with me. I would raise the bed, raise up the patient, close the curtain for privacy, lower the side rails, and then I would set up my drape on the... Okay, so set up my drape, and then I would make sure all my suction's set up. My suction would be at 100 to 120 continuous, and then I would have an ambu bag here at 12 liters or the highest it'll go. And then I would put a pulse ox on the patient. If it ever dropped too low, I would stop what I was doing and put their mask back on so they can breathe. And then I would auscultate the patient to make sure there's stuff in their lungs or in their trachea that I would clean and suction out. And I would do this before and after. My next thing I would do after all that, I would open up my sterile saline. Grab my tracheotomy suction kit. I would then open it away from me. I would then take out my sterile gloves. That is the only thing I can touch in here. I'm going to be using my own, so I'm just going to move these ones off to my side. The next thing I would do is get these out. Open them up. Okay. So, one glove on. Next glove on. Now I can fix them because they're sterile. Okay, so then I have this as a sterile field that I can set things on if I need to. So I would then take out this little box, open it up, and leave it in. Put it on here, it's still sterile. Then I would remove my suction tube, throw that part away. I would then wrap this part around my dominant hand to make sure it stays clean. After that, I would then I'm gonna dirty one hand. So I would take this, pour my sterile saline in. After I poured my sterile saline in, I would take out this and plug it in here. And this is still clean, and then this is dirty. So I would test the suction. So test with water, it works. So my next thing I would go ahead and do is insert with thumb off until I met resistance, making sure not to touch anything else, and then start suction. Sound effects. Take out, let go, grab the ambu bag, give him a couple breaths. 1, 2. Put the ambu bag back down, come back, clean the tube, and then if he needed another one, I would go back in. And then suction, 1, 2, 3, and then come back out. I would then, and then before I do anything else, I would take the ambu bag, give him a couple more breaths, and then I removed the mask earlier. I would now put the mask back on so he can breathe, and then I would start cleaning up. So I would take this off, wrap this, put this into my glove, remove my gloves, throw them away, remove everything else. Okay, so I'd leave the drape there because I'm now going to move on to my tracheostomy cleaning. So the first thing I would do, after I've cleaned up everything, I would do hand hygiene. Then I'd get my tracheostomy care kit, just in case, perform hand hygiene again. Open the care kit away from myself. And then I would then get my, I'm gonna fix my patient real quick so it's facing us. So then I would grab my gloves and start to put them on. Oh, I think this is the wrong hand. You know? No, I just missed the thumb. Fix it in a minute. So I would grab the next one. It's a bit big, so I have to unfold it. There we go. Good Lord. Oh my God, I can't get my hand in. There we go. Okay, so now I can fix it. I can actually grab onto it. All things are sterile. Put my thumb in. Ouch. Well, that's a little bit better. Okay, so now that that's all done, I would remove the gauze. Okay, I made a mistake. I used my dominant hand to remove it first. So I'm not gonna use my dominant hand. That's what I would fix. I would remove it with my non-dominant hand. Oh God. Oh, the trach fell out. So I'm gonna have my assistant here fix that for me so I can not have to do this again. So, okay, so fixed. Oh God. The red thing normally does not want to stay in. But what I would normally do, I would use my dirty hand to remove it, and then I would throw that away. And then with my clean hand, I would have the other one that I have inside my trach kit, and I would put it back in. And then I'm done with the sterile part of this. So my next thing would be I'm going to remove the things I do not need. So I'm going to remove these. Whoa. They do not want to be removed, I guess. So then I have sterile saline that I would pour in here. Since I'm done with sterility, pour it in. Get that out of the way. I would take my Q-tips that I have here. I would then clean around the site, not inside the hole. I would clean around. And then I would take some gauze. Not this fenestrated one. I'd take the gauze, clean around the outside, and then toss that. Use another one to dry around the site. And then I would replace the gauze around that. So there, and then if I was replacing straps, I would first put one strap and take it all the way around, and the new one I would put it on one, take all the way around, clip it, and then after I've secured the new one, I would then take the old one off, and then deglove, and throw everything away according to policy. And then I would also, after I've discarded everything, hand hygiene, thank the patient, I had another mistake that I missed. Before doing cleaning, I would auscultate the patient after I've done all my suction to make sure that the airways are clear. That is how I would fix my mistake of not auscultating. So after I've done my cleaning, I put my new strap around the patient and hooked it on, and then remove the old one. After I've hooked the new one on, I am done. I've done hand hygiene. I've thanked the patient. I've put the bed down, put the rails up, made sure the patient's comfortable, ask if they need anything else, and make sure their call light is within their reach. And I'm done. Thank you.